Good evening, everyone. I'd like to thank you all for coming. This press conference is to address any questions and concerns regarding the crisis that's occurring in the nation's Northeast and Midwest states. Right now, we want to go ahead and announce a public health emergency. This emergency is due to a defective batch of this season's flu vaccine. On December 15th, it was discovered that a batch of the flu vaccine, once administered, mutates once it comes in contact with the body's immune system. This mutation occurs within 30 days of injection. Once a mutation occurs, symptoms of severe vomiting, diarrhea, fever, and or headache have been reported. 3 to 5 days after the initial symptoms, individuals may experience paralysis. Fatal cases have also been reported 5 to 6 days after the initial symptoms. The defective batch of the flu vaccine has been identified and has been recalled. Once the remaining vials have been received, work on a counteractive drug will begin. Until then, it is imperative that those who have received the flu vaccine this season and are experiencing symptoms seek immediate medical assistance. Currently, emergency response medical stations are being established in major metropolitan and rural areas. These stations are equipped with personnel to properly triage and direct individuals who are experiencing these symptoms to the appropriate medical facilities. The location of these stations can be found at all FEMA and CDC websites. For those who have not received the flu vaccine, there is no need to panic. These symptoms caused by the vaccine are not contagious. All other information regarding what to do, where to go, and who should be seen can be found on FEMA and CDC websites. I want to go ahead and assure the American people that we are working around the clock to ensure that those who are affected by this vaccine are cared for in a quick and effective way. Right now, I want to go ahead and open up the floor to any questions from our press.
Director,
Yes.
What is your first objective?
Our first objective is to immediately open up these emergency response medical stations so that those who are seeking care and have questions can go straight to them and be pointed in the right direction in which medical facility they need to be seen at.
Okay, but who will be in charge of what?
Right now, we're going to keep the states in charge of their own program. Each state will have their own emergency medical response stations. Those stations will work side by side with emergency medical services and local hospitals. Patients that are seen at either of the three will be reported to that state's individual public health agency, which will then be reported to the CDC. The CDC will begin to analyze that information and pass it up to FEMA so any other precautions need to be made.
Okay, but what are some public health concerns that can result from this?
Right now, we're concerned with the fact that the vaccine has caused such an adverse reaction and that lives have been lost due to this. People will become fearful of receiving the vaccine. We want to go ahead and make it clear that this has been a controlled incident. We have identified what vials are defected. We have recalled those vials, and counteractive drugs will be developed to prevent any more loss of life. But the flu vaccine and other vaccines are pivotal in preventive health and public health, and we want to go ahead and ensure the American citizens that this event, although it is probable, chances of this occurring are slim, and we are responding adequately and quickly.
Okay, but what populations are at risk?
Right now, we are primarily focused on the populations that have received the flu vaccine this season. Again, the symptoms that have occurred are not contagious, and we don't foresee any other adverse reactions occurring since all vials have been recalled. If reactions do start developing, we want these individuals to immediately report these cases so that we can better address that when the situation arises.